Hi, everybody. Thank you so much for joining us today on our latest Seed Wellness podcast. And this week at Seed, we are focusing on the topic of autoimmunity. This is a health subject that we've been kind of talking around a lot at Seed recently, and we felt that it was worthy of a campaign because there are so many different types of autoimmune conditions for so many different types of reasons. And today I'm delighted to be sharing the mic with Fiona Martindale, who is Seed's Holistic Lifestyle Practitioner located in Welwyn Garden City in Hertfordshire. And the reason I'm also excited to speak to Fiona is because her background is as a GP, and she is still working as a GP every week, part-time, and is now running her own business on the side, Hope for Health, which is really focusing on all the areas around, lifestyle that can aid a person and their health. So, hi Fiona, how are you?
Hello, thank you very much. Yes, I'm well, thank you.
Good. Thank you so much for joining us today. And yeah, so we're speaking to you today with kind of, with from a dual perspective, really. Obviously, as a GP, you have been seeing, or you regularly see people with all autoimmune conditions in your practice.
Yes, I do.
Can we talk about that? What you're
Yeah,
seeing on the ground in clinic day to day
yeah.
in
Okay.
terms of the types of conditions that you are seeing, the rise that you're seeing, the possibility behind that rise, and
Mm-hmm.
and different ways that you can support your patients, or advice that you can give them so that they can support themselves better.
Yes, absolutely. So, I think initially it's important to say that if you look at various different lists, there are probably around 150 to 200 different autoimmune conditions recognized,
Wow.
depending on what list you look at. Obviously, a lot of those are very, very rare. But there are some which are really relatively common, and evidence would suggest that they are becoming more common and certainly have become more common over the last 30 to 40 years. The things that I probably see the most of are one, probably not a surprise to anybody, would be eczema and celiac disease. Those are probably the most common. I think we also see a relatively larger amount of Crohn's and ulcerative colitis grouped together as the inflammatory bowel diseases. And then one that has become more and more well recognized over the last 20 to 30 years, and has become considered possibly an autoimmune condition as well, is fibromyalgia. And that we are definitely seeing more and more of. And there was initially they thought fibromyalgia was not an autoimmune condition, but there is now emerging evidence that autoantibodies are likely to contribute. And so it is now classified within those autoimmune lists most of the time.
Okay, interesting. Wow.
So those are the four that I would say I see most often. I think we also see quite a lot of thyroid disease, some of which is autoimmune. Type 1 diabetes is considered autoimmune. There are various gastritises that are autoimmune, and then there are all sorts of more rare conditions. Obviously, you've got your rheumatoid arthritis and your psoriasis. Those are autoimmune conditions as well.
Okay, so when patients come to you, first off, some of them will already be diagnosed with an autoimmune condition, others
Yeah,
won't.
yeah.
How much of your job is diagnosing people?
So I would say that a GP, their specialty is the patient in front of them, and we are diagnosticians. That is kind of our skill set. So a large proportion of my job used to be diagnosing. I think more and more of my job is taken up with management of those chronic conditions that have previously been diagnosed. It's quite difficult to put a number on it, I think. Um, GPs always laugh about the fact that we have days of one thing followed by days of another thing. So I'll have a day in clinic where I only see tummy problems, and another day in clinic where I see 5 or 6 people with eczema and psoriasis, and everything else is skin lesions. So it's very odd how that happens, but it's a bit of a running joke with GPs. So it is very difficult to say, because there will be some days where I really only see chronic illness that is ongoing. I'm not diagnosing anything. I'm certainly not diagnosing a new condition. May well
Yeah.
be diagnosing complications or trying to help somebody with a new symptom that they've got from their condition. That's a slightly different thing.
Okay.
But
Yeah.
yes, difficult to say.
Okay.
I
And
think,
yeah.
go on.
So, in terms of what you are seeing, either diagnosed or undiagnosed,
Yeah.
you're talking about the symptoms, and you said yourself, it's helping people manage the symptoms they have.
Yes. Yeah.
Okay. So, how do you do that? What symptoms are you seeing in these conditions mainly,
Yeah.
and how can you help people manage them, alleviate them, even overcome them?
Okay. Broad question, because obviously it depends on the condition. Um, I think what might be most useful would be to talk specifically about the four that I mentioned first
Yeah.
up, like
Yeah.
that as the most common.
Yeah.
Um, Eczema. I looked some things up earlier. So eczema. This is a bit old now, but in 2003, The Guardian wrote an article stating that childhood eczema had tripled since 1970. It doesn't look like it's actually gone up much further since 2003. And in fact, in some demographics, it's possibly started to come down a bit. Eczema is thought to be due to a combination of autoimmunity and environmental conditions. And I think this is
Okay.
often true with autoimmunity. It's often triggered by something.
Okay.
And in the main, that seems to be some kind of environmental trigger, whether that is illness, stress, environmental toxins, etc. With
Okay.
eczema, there is still a theory that a house that is too clean,
Okay.
or where a lot of antibacterial agents are used, or bleach agents, those sorts of things, that actually decreases the health of the skin microbiome in small children, and that then they develop eczema. So that is a theory, still quite a prevalent theory. I think there are other thoughts about how the food that we take in might affect eczema, gut microbiome. We know that eczema is significantly more likely in a child who is bottle-fed formula than a child who is breastfed. So there's clearly some gut microbiome and immunoglobulin kind of issues there. So, I mean, when you've got eczema, that you have to deal with it, because actually it's not just a patch of rough skin, it's not just dryness. There is a problem with the barrier of the skin. It's actually malformed skin, effectively. Um, and children do grow out of it. Not all children grow out of it, but a large proportion do. And then we do see eczema less through adulthood, and then it tends to get worse again, or more common, I should say, into older age. But there are lots of emollients out there that are used by all GPs, and patients may know of, they may have used, so all different brands. They're all petroleum based.
Mm-hmm.
But I think more and more people are trying to turn to the natural remedies, and things that I've been recommending for years. Oats in the bath, absolutely
Yeah.
brilliant for
Yeah.
eczema in a small
Okay.
child. Aveeno is one of the brands of cream that is often used, and that contains oat extract. And actually, if you use oat milk, or literally you put oats in a muslin, tie a hairband around it, use that as a sponge in your child's bath, that's brilliant for eczema. Coconut oil is really good for eczema. So these things are
Yeah. Helpful.
natural alternatives, and I think are really, really helpful. Um,
Okay, so let's move on now to celiac. So that was your
yeah,
second on your list. So you
yeah,
were talking about environment, you were talking about food, diet, and then
yeah,
you were talking about, in the case of skin conditions, like creams that are being used, which traditionally were, like petroleum based, you say.
yeah,
And I think I kind of get a sense of where this conversation is going. I think what you're talking about is the different. But anyway, let's carry on. Let's talk about
yeah,
celiac.
yeah. Okay, so celiac. Um, Celiac was was rare when I first became a GP, so sort of 20 years ago. Wasn't diagnosed very often. I think part of that was that we are better at diagnosing it now than we were then. But I think quite a large proportion of it is actually that there is an increase in celiac disease. It is now estimated that 1 to 1.5% of the population may be celiac in the UK. But it's also estimated that only around 30 to 35% are currently diagnosed.
What are the symptoms of celiac?
So they are many and varied, and I think this is the problem. So the traditionally recognised symptoms of celiac would be a child with failure to thrive. So they're not putting on weight, they're not growing properly, they might have constipation or diarrhea and tummy ache. That would be kind of the traditional expectation, but we are now seeing celiac disease diagnosed in adulthood or even later adulthood.
Okay, so what?
It is unlikely that they have had celiac all their life because they wouldn't have thrived as adults.
Okay. So what do you think is behind that?
It's got to be multifactorial, but my gut feeling is that most of that is to do with ultra processing of foods, and particularly of bread.
Okay, interesting. Okay.
And potentially the increase in wheat-based products that people have eaten over the last 40 years.
Interesting. Okay, so let's then talk about, so obviously the ways to remedy, alleviate symptoms would be to trying experimenting with cutting out those types of foods to see if there's an improvement. Okay, so let's move on to the third one that you listed.
Mm-hmm.
What was your third?
So IBD, Crohn's and ulcerative colitis.
Interesting. Okay, I'm seeing this a lot as well. So again, symptoms.
Ulcerative colitis will usually present with an initial flare of pain, either when in the lower abdomen or pain passing stool, blood, often when passing stool or even not when passing stool. And significant abdominal pain, possibly some vomiting and diarrhea.
And what do you think is causing this? Go on. Yeah, so
Sorry,
Crohn's
I was
is quite
just going to say
different.
Crohn's can present quite differently. It can be more insidious.
Yeah.
Might just have lots of mouth ulcers, might have generalized pain. Again, might have the proctitis, which is the inflammation at the anal opening. So that's where you get the blood and the pain passing stool. But can be more insidious and more weight loss, lack of thriving, etc., etc. I mean, these are known long-term known as autoimmune conditions. There is definitely a genetic element. There is definitely, however, in the majority of people, a trigger. And for some people, that will be stress. For others, it will be a virus. For others, it may be more what we would call an internal stress. So that could again be ultra processed foods, or it could be just a complete lack of decent nutrition, meaning that they became very malnourished and then their body couldn't heal properly, and then that has caused internal stresses on the body that have triggered the autoimmunity. So I think again multifactorial.
And how would you address, and obviously there's again, medically there are ways of addressing it. How would you address that from a lifestyle place?
Okay, so I think with IBD, it's really important to say that personally, I think somebody needs to be treated medically, and then the lifestyle things need to be used as support for that medication regime. And that potentially with the right support and with the lifestyle stuff, the medication regime may well be less than it would otherwise have been. But I think it's really important to say I don't think it's safe to just do the lifestyle stuff.
Agreed. And we don't say that, Steve. We also work either alongside.
Yeah, exactly. So I would do quite a lot of work with them on anything to decrease inflammation, because obviously both of them are inflammatory. So anything to decrease inflammation. So that is all the pillars of lifestyle medicine can help decrease inflammation, making sure you get enough sleep, making sure that you're connecting with people and having social time and gaining, joy and contentment from your relationships. Eating the right food. So there are plenty of good anti-inflammatory diets out there that I would talk to people about. I would personalize with somebody in front of me, but there are things you can look at online. Um, Sorry, what have I done? Sleep, social connections, dietary based stuff, exercise, time in nature. These are all ways to decrease cortisol, decrease stress, and therefore decrease inflammation. And drinking plenty of water, staying hydrated, really important for your, particularly with an inflammatory bowel disease where you may be losing more fluid than the average person through your gut.
Interesting. I mean, this is the four pillars again. And I know anyone that listens to this podcast regularly knows that I just harp on about the four pillars all the time because they are just so important to be addressed individually as well as collectively,
Yeah, absolutely.
because obviously they make up us as one whole. Okay, really interesting. So let's move on to your fourth one that you listed.
The fibromyalgia.
Oh, okay. So pain.
So fibromyalgia, I mean, it's really difficult to say how much the incidence of fibromyalgia might have increased over the last 20, 30 years. It was only proposed as a diagnosis some point in the 90s, I think. So even after chronic fatigue. So chronic fatigue in the 80s, that was yuppie flu. Sort of by the mid to late 90s, that was recognized as probably an actual thing. Post-viral fatigue syndrome certainly recognized. Fibromyalgia, probably, I mean, I never heard the term until the mid to late 2000s, I would say.
Okay.
And at that point, it was like, oh, this is the new yuppie flu. It's kind of how it was viewed by the medical profession. It's like, oh, for goodness sake, get over yourselves. And I think because of that, it's really difficult to say how much has the incidence increased because we weren't recognizing it. We weren't acknowledging it as an actual problem. But I do think that the incidence probably has increased.
Okay.
I think there are more people in chronic pain more of the time than there used to be.
Okay.
And certainly our consultations in general practice have increased enormously. But whether that is also to do with the fact that patients are aware of it and they go, hang on a minute, I've got these weird symptoms, maybe it's fibromyalgia, and they can look it up and they can kind of recognize things in themselves and come and see us about it. So yeah, really difficult to know, but I know I'm seeing it more often than I would like to be seeing it, more often than I think it is reasonable to be seeing it. And there is clearly something going on in our lifestyle that means that we are not thriving.
Okay.
Because to me, that is what fibromyalgia is. It is somebody who is not thriving.
Yeah. Actually, I mean, I've been speaking with people with fibromyalgia. We ran a chronic pain campaign at Seed only a few months ago, and we really deep dived into this. And fibromyalgia, I think the one lady that I spoke to, who is now our medical health coach, actually, she's a medical coach at Seed, helping people to navigate these conditions, because actually she's saying it's okay to feel like even if your pain isn't actually really pain, because obviously it's you feel like you're in pain even though there's no reason why you should be. So there's a sense of like non-value to it, which is what you're saying, like the medical profession, they didn't take it seriously because it was like, well, there's nothing showing on a scan. There's nothing showing on an x-ray. It must be all in your head,
Yes, but we now know that there is an autoimmune element. There is probably an epigenetic element. So that's where you've got genes that get triggered, get switched on or switched off. So genetic predisposition and then a trigger. And known triggers for fibromyalgia are trauma and stress.
Okay.
Probably also infection as well.
Yeah.
But trauma and stress are the big ones. And this could be birth trauma, or this could be adverse childhood event type traumas, or this could be a road traffic accident, or, many trauma. It could be severe complications after an operation. I've seen that. I've seen road traffic accident. I've seen ACE, adverse childhood events. That probably was the trigger. So I've seen all of those, but I've also seen people who have just been through, chronic either health stress or social stress for a few years, and they come out the other end and then they develop symptoms.
Yeah.
And it's like, well, they've still got this stress stuff going around, but nothing to focus it on. So now it'll focus on the body. That's kind of how I describe it to people.
And how do you treat people with fibromyalgia medically?
So within the NHS, we have chronic pain clinics. We have access to analgesic drugs and the sort of pain modulating drugs. So patients will have come across amitriptyline, gabapentin, and pregabalin, which are often used in fibromyalgia. I think we all in general practice would be recommending that somebody with fibromyalgia potentially tries to think about maybe some CBT and or counselling, depending on if you can really obviously discern trauma. We'd all talk about massage and acupuncture and seeing a physio or an osteopath, or just trying to get patients to realise that they're going to have to use some self-help techniques.
Yeah.
One of the other things that I now recommend to people, having come across it recently, is an organisation called SIRPA, SIRPA. And that is a collaboration, a body of health practitioners from different walks of life who have done specific training in something called mind-body medicine. So there is an element of neuro-linguistic programming and various other techniques that they use. And I think from the learning that I've done around that, from the conference I went to, the SIRPA conference I went to, and just from talking to people who have been through that, I think that is something we maybe need to be tapping into more for these people.
Okay.
Because it's debilitating. I try to explain it to people. It's not that you haven't got real pain. You have got real pain, but you shouldn't have, because the stimulus isn't there. So what we need to do is we need to cause your brain and your nerves to rewire so that they're not sending pain messages that aren't needed.
I will say, actually, we are supporting the Pain Cafe over in Buckinghamshire. We are supporting their Pain Cafe, NHS Pain Cafe, once a month. We are sending in practitioners each month, and we've had Qigong, we've had breath work, we've got a mobility coach going in.
Amazing.
In January. We've got acupuncturists going in. We've got all sorts, yoga and Pilates and the body workers.
Really important.
And the mind work is like you're saying.
Incredibly important. Yeah.
And just trying to show, because
for myself,
one size doesn't fit all. I want to say that, and I think this is really important.
Absolutely.
Stress, you've got to try things to find out what works for you.
Absolutely. And for myself, so I don't have a formal diagnosis of fibromyalgia. I refuse to go down that path. And that comes from my kind of, prejudice from when I was younger as a doctor. But I have most of those symptoms if I choose to focus on them.
Yeah.
So for me, a paleo diet has made a massive difference. I don't do it all the time. I don't do it very strictly. I notice when I don't do it for too long, I get more back pain, I get more stiffness, I get more trigger point pain, I get more tearful, blah, blah, blah. But regular yoga, regular Pilates, having a massage, I've had acupuncture in the past, I've had osteopathy, I've had chiropractic. I kind of do a bit of everything: swim, eat well, walk, make sure I'm wearing appropriate shoes, keep warm, whatever is working.
All these things outside. That's really, really helpful. Their lifestyle tips. And, this is what we're talking about more is, how people, our aim is to inform, inspire, empower. So people know what the different things that they can try that may be supportive of any regimen, whether it's on a medical regimen.
Absolutely. And I think with fibromyalgia as well, probably we need to be thinking about vitamins and minerals. We need to be thinking about vitamin D, zinc, magnesium in particular, and potentially some others as well. So,
well, that's really, really useful to talk to you. Is there anything else you want to add in general about autoimmunity before we wrap up?
Just to say, I guess that, yeah, I think it is, the question you asked me kind of before the podcast was, do you think it's on the rise? And yes, I do think it's on the rise. And actually, there was a 2023 cohort study looking at 22 million patients across the UK, which says there is an increasing incidence in the total autoimmune burden from the 19 most common autoimmune diseases between 2000 and 2019. And they stated that the socioeconomic, seasonal, and regional disparities observed amongst several of the autoimmune diseases in the study suggest environmental factors in disease pathology which need to be looked at further. And I think that's probably just something that we just need to be aware of. Environmental factors can be anything from the food you're eating, and whether it's got pesticides and fertilizers in it, to the particulate pollution in our air, to whether the water has got too much chlorine in it or fluoride, or has got pathogens in it, or has got bits from your lead piping in it, or molds in your house, or pollens,
Household
or
products.
anything. Environmental is broad. That's
Yeah,
what I'm saying, really.
yeah, no, it's interesting. We are going to be doing a podcast on that, so I'm going to come back to you about that and get your view on that separately, because I think that'll be really helpful. Well, thank you again for sharing that, your information, your expertise, what you're seeing, because actually that's what we need to draw on is what's actually happening, as opposed to this is the reality of what's going on, and statistics are one thing, but hearing it from the horse's mouth is something else. So yeah, that's why it's been really valuable to talk to you. So thank you for sharing your time with us. So if anybody
pleasure, thank you.
Thank you. And if anybody wants to find you, they can go to the Seed Wellness website, seedwellness.co.uk/Fiona Martindale. So Fiona is a GP, but is also just, working focusing much more on the lifestyle elements around that, and how we can support our health from a whole 360 place, which I think is becoming more recognized, both within and outside of the medical profession. So it's really refreshing as well, Fiona, to talk to you, and to know that is a focus for you, because that's what we're seeing as well as healthcare practitioners. Although we're not medical, we are still healthcare practitioners, and it's just really good that we can bring our worlds together and bridge that gap, because I think together we can help more people, more. So.
Yeah, absolutely. And thank you very much for giving me the time.
My pleasure. And if anybody wants to get in touch with a more generic question, you can email into info@seedwellness.co.uk, and we will filter your inquiry out to the appropriate practitioner. Thank you again, everybody, for joining us today. Thank you again, Fiona. Stay tuned with us this week, because we've got a lot of different content coming out about the different types of autoimmune conditions and different ways and different modalities that can help. Our aim always is to demystify the different offerings that we have, because there are lots of them, and it is quite difficult to find the one that is going to feel right for you and actually work for you, but we're here to kind of guide you on that journey. So do feel free to reach out if you need help. Thank you again, and we'll speak to you soon.